practice is more than just medical management of patients. There's a big emotional side to being diagnosed with a cancer of the eye. You know, USA Today, a few years ago, took a poll of America and asked Americans, what do they fear most? The number one fear in America is cancer. The number two fear is blindness. So this is serious business that we're dealing with. We're dealing with real people living real lives. We have a large team of people here. It's just a whole team of people working together to solve this problem of eye cancer. How to protect the sight while you're managing these cancers in the eye. I remember when Ativex arrived in our office. Here's a beautiful 14-year-old girl sitting in front of you with a pigmented growth in her eye.
And a really difficult time for us, like our parents, because it's not, if the melanoma stay in her eye, we can treat it. But if that cancer stem all over other parts of your body, it's really dangerous. It could be taking her life.
So we did a needle biopsy with our fingers crossed, hoping that this would be benign, and it was mostly benign, so that's good. But there were a few cells that were cancerous.
So that was a really hard decision, and I talked with my mom and my dad, and they said, if it's the only decision, well, we can't do nothing.
And knowing that she has every intention of living to be 95 years old and continuing her dancing, etc., we said it would be safest to have treatment.
In the morning of my surgery, I was nervous because I was going to have a surgery in my eye. So I was just afraid, nervous, and a little bit sad for my mom.
I've had more patients than families, and so I see people going through chemo and going through surgeries and not knowing what the result is going to be.
Before the surgery, we talked with Dr. Shields, and she told us we're gonna do a good surgery.
My daughter had a surgery a week ago after the diagnosis of the biopsy. They decided to put the radiation plaque on her left eye.
So we treated her with a little radiation implant. It took 4 or 5 days for the radiation to affect the tumor. The tumor is now cured. The problem is solved. Her life is now safe.
It's a miracle for my daughter, for our family to be here. And I don't cry for sadness, it's just for joyful, because we thought that never is going to happen.
I really have to thank Host for Hospitals for all they've done for our patients over the years, for providing that little piece of information or that little piece of daily living that nearly every patient forgets.
We just have laughed and buoyed each other up. We've talked a lot, and the talking was important.
Yes.
Ativex plays my computer games. You know, I really felt part of a family.
There's no place like home. There's no place like a Host for Hospitals home.